Hello and welcome everybody to this very important interview today with Dr. Alvin Danenberg.
Do you no. Let's do Al. Absolutely.
Al, okay, you got it.
Yeah.
Dr. Al Danenberg. Thank you so much for making it today. I'm really excited for our interview today. A little bit of a background. In September 2018, you were diagnosed with incurable bone marrow cancer, namely multiple myeloma, and you were given 3 to 6 months to live. After a great deal of research and consideration, you rejected chemotherapy, and you took your knowledge in ancestral nutrition and immune health, and you created your own 10, I think now there are 11, unconventional cancer protocols. So before we dive in, would you mind sharing a little bit more about your background for our audience?
Well, absolutely. So I'm almost 75 years old, so there's a lot of background. How far back do you want me to go?
You can take as much time as you want.
So basically I'm a periodontist. So I'm a dentist that has specialized in gum treatment. And I was practicing periodontics for 44 years, much longer than you were alive, by the way.
True.
And and so I stopped practicing in 2018 because of what happened to me. So you want me to tell you a little about this story?
Yes.
So in 2018, at this point, I thought I was really a healthy guy, almost like a senior poster boy for health. And I was writing and lecturing, and actually what I was doing was traveling to Austin, Texas in April of 2018 to speak at Paleo FX meeting. And when I was traveling, I live in Charleston, South Carolina. To get to Austin, I had to transfer in the Atlanta airport, it's a big airport. Generally what I do when I have plenty of time between flights, I walk the concourses rather than take the train. I put my bag on my shoulder and walk, and everything is cool. Well, at this time I was walking and my right shoulder got sore. I don't know why. I thought I pulled a ligament or something. Got to the meeting, did my thing, got home, and this right shoulder stayed sore. And it was very unusual for me to have that experience. But after a month or two, it seemed to go to my back. And then the soreness went to my chest. And so it takes a long time for me to make a decision. So I finally, in September 2018, said, I need to see my doctor because something is going on and it's more than just a torn muscle or a ligament. So I go to my physician in September 2018, and he says, yeah, probably things are going on. Let's do some blood work. Everything looked good, except I had what's called a high C-reactive protein, which is indicative of, say, some kind of inflammation in my system, but they don't know where it is. So then he does an MRI to see just where a tear or some damage is going on. And when he gets the MRI back, he calls me and says, and he knows me very well, he says, Al, do you want to come into the office? We'll talk about what I see, or you want to go over on the phone? And I said, hey, just give me an idea of what's going on. He said, and he gets, first of all, he kids around, he said, did you fall down some steps or did somebody beat you up? And I said, of course not, what's going on? And he said, well, the MRI shows several rib fractures, a vertebral compression fracture, a hairline fracture in your pelvis. And then he gets very serious and he says, it looks like lymphoma, leukemia, or multiple myeloma. Oh my God, these are 3 cancers. Oh, how could a healthy guy have cancer? I just thought I tore a muscle or a ligament. So he then sends me to an oncologist. Before I see the oncologist, does a bunch of tests, and I get this diagnosis that it is incurable bone marrow cancer called multiple myeloma. The reason I'm having pain is that there are lytic lesions, holes throughout my skeleton. And unfortunately, multiple myeloma creates problems in the bone, and it makes the bone very, very fragile, almost like a person with severe osteoporosis. And these people generally get a broken rib or a broken bone, and then they go to the doctor, and all of a sudden they're diagnosed with this disease. So he gives me 3 to 6 months to live. And I say, well, this is crazy. I'm not doing chemo if I only have 3 to 6 months to live. I have no interest in longevity. I only wanted quality of life. Now, of course, this is very devastating. My entire life is coming to a stop, right? I'm 71 years old at that time. So I reject chemo. I do radiation treatment on my chest because it was very difficult to breathe because of the broken ribs. So that took care of the pain, doesn't take care of the cancer. And I create these, at that time, 10 unconventional cancer protocols. I'm doing the things that I think I need to do to make myself as healthy as possible. The most important thing I can do is to improve my immune system and create a quality of life. Whatever happens with the cancer, I want to make my body as potentially healing as possible. And I do very well. My oncologist is shocked. I do very well. It comes to next year in August of 2019. And I realize my bones are fragile, but I'm doing well. Never been in remission, never have been in remission even as of today, but I'm doing well. So I'm brushing my teeth and flossing my teeth in the bathroom. Obviously, I know what I'm doing, right? So as a periodontist, so I'm brushing my teeth. It's at night, and I'm flossing, and I go to throw the dental floss away. My trash can is to my left, so my feet are planted on the floor. I twist about 90 degrees to the left to throw the dental floss away, and my right femur snaps in half. I crash to the floor. I break a couple more ribs, and I break my right humerus in half. Now, I'm writhing on the floor. It's relatively painful, by the way. And I'm screaming for my wife, who comes in. Of course, there's a lot of emotion involved, and she calls emergency services, and they get me out of the bathroom to a hospital. Now, I've lived more than my prognosis. And everybody that I know in my age group that gets a broken hip, for example, does very poorly, and many of them die. And I'm thinking, I broke all these big bones on my right side. I'm ready to die, and I want to die. So I go to the hospital. They fix my right femur because I'm going to bleed out from the femoral artery if they don't. And they don't fix my right arm. They don't do anything for the ribs. And they literally put me into a hospice hospital to die. So I'm in hospice at the end of August 2019. Interestingly, there is a hurricane coming to Charleston the first week of September. And the hospice hospital is ordered to evacuate all their patients. They don't know where to send me. And my wife, who's an RN, gets a hospital bed, and they send me to my home. And my wife, who is phenomenal support, gives me a whole bunch of tough love and says, look, let's fight this thing. Let me get a physical therapist in the house. Let's see what we can do. Even I'm still in hospice, but at home. And we get a physical therapist in. I start my unconventional cancer protocols again. He gets me out of the hospital bed. I've been on a catheter for 30 days. Oh my God, that's a terrible experience. Finally get rid of that. And I start to walk with a walker. I do improve. I revoke hospice and see my oncologist the following month, and he thought I already died. So obviously I didn't die. We do some other things. We get a new PET scan, which is an X-ray that shows cancer cells in May of 2020, and it shows no cancer cells. Phenomenal, unbelievable. Now, PET scans, no cancer cells that are active. Now, PET scans are not complete. They only show moderate amounts, but they can't show small amounts. But I'm not in remission. I'm okay, but this is amazing. And then as this,
why are you not in remission if there are no cancer cells? Is it because of the inaccuracy in the PET scan?
Yes, the PET scan only shows moderate to advanced levels of cancer cells, and my other blood work that shows dysfunctional antibodies, which is produced by my cancer cells, which are malignant plasma cells, are still quite abundant. So I still have cancer, but I'm doing really well. Then, do you want me to continue with this story to get to today? So yeah. So I continue to do well, and I do start what's called an immunotherapy drug, not chemo, but it's a monoclonal antibody that is supposed to help kill malignant plasma cells in my condition. I start that and I do very well. It's theoretically there are side effects, but I never had any side effects. And I do that month after month after month until June 22nd of 2021, last year. I had the same therapy drug and the nurse actually screwed up. It's supposed to be subcutaneous, meaning they give it under the skin, but not in a vein. Well, she poked the vein bled, and the injection probably went into the vein. I had this hematoma, this big blood clot thing was 2 or 3 centimeters wide for about 5 weeks. And then I started having a lot of symptoms like achy pain, achy muscles, achy joints. And then I got really sick. I was exhausted. I had headaches, I had diarrhea. I didn't lose taste or smell. And all these things happened. And my physician, my oncologist, concluded that maybe the immunotherapy started the problem, but then I got COVID on top of it. And those were the symptoms, and it just wiped me out. Now, because I really have improved my immune system, I didn't use any medicines. I didn't have to go to the hospital, but it was a long effort to get over these terrible symptoms. Well, by January of this year, I was doing well, and my oncologist said, let's try the immunotherapy again. Okay, so I did the immunotherapy. January of this year, fine. February of this year, I did it again, and all the symptoms came back. And not only did they come back, they were worse. And he had a new PET scan, and it showed that the multiple myeloma was reactivated from all this nonsense. So where I am now is to get back to the healthier state. Obviously, I'm not doing immunotherapy anymore. The COVID created a weakness in my body, did some damage, and at this point, I am repairing my body.
Okay.
We speak.
Yeah. So those 10 unconventional protocols, I'm going to obviously post them in the YouTube description box so people can link to them directly. But do you want to brush on them real quick?
Absolutely. So what I do, excuse me, what I do is, again, the bottom line in my mind is to support my immune system. Anything and everything your body fights is because you have either a robust or not a robust immune system. Not only externally, but internally. Your immune system naturally kills cancer cells that every one of us have 24 hours a day, 7 days a week. We have cells that go crazy. They become theoretically cancerous, but they either kill themselves off or the immune system searches them out and gobbles them up. So I want this immune system ideal. So how I do that is this. One major element to my protocols is an animal-based diet. The research is replete in showing that human species require animal protein and animal fat. No matter what anybody says, at least the last 2.5 million years have proven it. It's not a fad diet, obviously. It's not just meat and eggs. It is healthy animal flesh, animal meat, not animals that have been raised with grains or injected with hormones or inhumanely raised. These are animals that are naturally raised like pets. You know, there are farms that do what they do. And so I'm eating the red meat of beef and red meat of lamb. I'm eating organs. I'm eating cartilage. I'm eating animal fat. I am doing those things from nose to tail. Critical elements. Every nutrient, for the most part, every nutrient your body requires is in those foods in a bioavailable form in a natural ratio to one another. Nothing is synthetic here. So I do that. I make sure that my water is healthy. I use natural spring water. I get it from a company called Mountain Valley Spring that is delivered to me in glass bottles. And that diet is a critical element. Now, my diet is not 100% just animals. It is some raw honey. It is some fruit. And that is how I eat. And some of the research, especially in Budapest, Hungary, shows that there's a hospital there that's been in existence for 11 or so years, a paleo medicina clinic. They have treated severe chronic diseases and cancers. Many of them are theoretically incurable. And they have treated, and those patients have done well, not only gotten into remission, but some of them have literally cured their diseases. And they use a strict animal-based diet called the Paleolithic ketogenic diet. They do not use any supplements. They do not use any pharmaceutical drugs. Quite impressive. If people would go online, they would even see case reports that they publish in English of some of their successful patients. Not everybody is successful, of course, but many, many are. So that's an element that is critical. Another element that's critical for my protocols is an extremely healthy, robust gut. Our microbiome, our garden of bacteria and other microbes in our gut literally talk to our immune system, and when they're not in balance, called dysbiosis, it creates every type of chronic disease known to man. It is critical for that gut to have a diversity of species, meaning many, many, many different types of bacteria that literally work together and crowd out potentially pathogenic bacteria so that it doesn't upset the immune system or get into the bloodstream. When that breaks down and the toxins get into the bloodstream, it will cause what's known as a systemic chronic inflammation that can go to any and every organ system, including the mouth, and cause all kinds of problems, including gum disease. So this is something that is critical to be on top of. Many diseases like cancer have its origins in a dysbiotic gut, as well as that damages the battery of the cells called the mitochondria. So if I can improve my gut microbiome, which I know how to do, I have a heads up on improving my immune system. The other thing is important, as I just mentioned, is to improve the mitochondria, the battery of the cell. Any and every cell of your body, except the red blood cells, literally need energy to survive and do what they're supposed to do, just like a flashlight can't beam a streak of light until the batteries are put in. And if the batteries weaken to the point where they're dead, the light goes out. Well, if those batteries in the cells, which are called mitochondria, get weak, the cell doesn't function. It doesn't create its energy properly, and it can become malignant and cancerous. So this is something that we need to improve, and the cell membrane that holds the cell together has to function and allow nutrients in and out of the cell, every cell of your body. Well, one of the things that I do that supports that, and I'm not saying this is the critical element of my protocols, it's just one of them. I use pulsed electromagnetic field therapy that generates frequencies that literally talk to the body's cells to enhance the membrane and enhance the mitochondria. And there is some research, and I've done some of my own research, that shows that does happen. So I am very critically involved with a healthy, nutrient-dense, anti-inflammatory diet, like I explained. I'm very involved with creating a healthy gut microbiome, and I'm very involved with maintaining a healthy cellular wall and the best mitochondria that I can, ideally. And those are three of the main protocols, and then there are others that I do.
Do you feel that you had to make a shift from your lifestyle before you got diagnosed versus after?
That's a great question. So I would say 6 years or so before I got diagnosed, I had an epiphany. I realized that I was not a healthy guy before that. You know, I wasn't, I didn't know that, but I wasn't. I was like everybody else. I was eating basically a standard American diet, which is a lot of junk food. I am 5'7" and I weighed 72 pounds. I don't know. It was, you know, I thought I was okay, but I was chunky. I didn't realize. So when I realized what was happening and I started to change my diet, I discovered a paleo diet, and I became basically, I lived the paleo lifestyle and I ate paleo food. In other words, I ate animal-based foods from nose to tail, and I ate fruits and vegetables and nuts and seeds, completely eliminated the grains, completely eliminated the legumes, completely eliminated processed vegetable and seed oils. And that's did me quite well. As a matter of fact, by the time I was doing what I was doing and lecturing and being in this paleo lifestyle, I lost from 172 pounds where I was all the way down to about 150, which was really fantastic. I was really quite healthy. When I was diagnosed, I was doing very, very well. So a lot of people say, well, obviously you didn't eat well, that's why you got cancer. Unfortunately, that's not the case. Cancer didn't happen overnight, even in 5 years. I did some research to figure out, I'm very geeky. So I tried to do some research. Why did I get cancer? Especially since I was eating for the last 6 years before I was diagnosed, so healthy and living a healthy lifestyle. Well, there was a paper that was published in the early, maybe 2010, something like that, a Brazilian researcher, and he investigated, observational investigation, but he wrote a paper that compared male dentists in my age group, 65 to 75, compared to the general male population of 65 to 75. And those male dentists at that age group had a significantly higher level, especially of multiple myeloma. Well, how could that be? And he didn't in his paper discuss why. It was just observational. So I'm thinking, what in my life, in my dental career of 4 years of dental school and 2 years of graduate periodontal school, in those 6 years, what happened that didn't happen in the general male population? Well, number one, when we practice dentistry and learn how to do dentistry, we're among dental x-ray machines all the time. This is low dose ionizing radiation, and low dose ionizing radiation is a significant factor in causing a plasma cell. These are B cells in bone marrow, a plasma cell to become malignant. Well, it only takes one malignant cell that goes crazy, doesn't kill itself off, the immune system doesn't work right, and that one cell could eventually grow to the point where 40 years later, I have multiple myeloma that manifests. There's another factor that, and because I'm in the clinic, we had like 100 students, there were many, many dental x-ray machines going on and off all the time. You don't know it because x-rays don't make a sound, they don't smell. I mean, you see a little red light maybe when they're on and off. And in those days, we were not that careful about protecting ourselves. That's way, way back, 1970-ish. So I probably was exposed to low dose ionizing radiation enough to do that. The other thing was, when you're in dental school, you're learning how to put fillings into teeth. Well, one of the major fillings is a dental amalgam. Dental amalgams are made with mercury. Mercury is highly toxic. Who knew how toxic it was in those days? So when we were, as students, putting mercury mixed with metal fragments and create what's called an amalgam, there's excess mercury that is mixed, and we play with the mercury in our hands like kids play with it, play with Play-Doh. And these are little silvery balls, and we throw them on the floor and they dance around and they evaporate. And who knew it was getting in the environment and of all the air everybody in the dental school was breathing. Every dental school in the country had that same toxicity. So that free mercury could very well have gotten into my body and created all kinds of damage and assisted in creating one malignant plasma cell. I believe that those two elements in my dental career way, way back was the precursor to the cancer I had. And then my life was not exactly clean and pure, obviously. So I had other toxic loads on top of that as time went by, and eventually more load than my body could handle created the malignancy. And I think that's where it was, emanated. Now I can't change it, but it's always nice to know where did it possibly come from. And if anybody were to ask me for help as to what they need to do proactively, is I would say don't get involved with anything that has potential toxicity, like free mercury and being around excessive low dose radiation, which nobody would be doing unless they were in the business of having radiation all around them all the time.
With regards to the mercury, I'm familiar with the chelation, where you take DMSA, I believe,
Yeah.
or even EDTA, you know, to pull that out of your system, because the half-life of mercury is 20 years. Have you played around with that or looked into that?
There is some interesting information about that. If you pull mercury out of the bones that have now sequestered the mercury in a more less damaging molecular way, when all that is pulled out of the body, pulled out of the bone, it gets into the circulation, and you could have serious high levels of toxicity of mercury than you never had before, and you could get very, very sick. I think that's a difficult thing to do. I'm not sure. There are people that know how to do it and do it very well.
Yeah.
Many people that play around with it, especially non-medical people that are not experienced, and they think that, oh, let me do this, it's going to detoxify me. They could be placing themselves in more harm than they are already. Now, your body does detoxify, like you said. And over time, if you are eating healthy, you're supporting your immune system, the body will detoxify itself naturally, not as fast as you or I may want it to be, but maybe much more in of a healthy way, and not get that overload of circulatory heavy metals or whatever you're trying to detoxify all of a sudden. There's so many other pathways that have to be functional, and you could really damage your kidneys and a lot of other things if you get this overload in the circulatory system.
Yeah, definitely. You have to be very careful, because I remember when I was digging into the research, they have to do it very slowly, and you have to take breaks. And those are people who do not have cancer or other advanced diseases, you know? So yeah, definitely be very careful. So, but with regards to the radiation, I have never heard of anything that you can, like, after the fact, go back.
Well, there's interesting with radiation too. I mean, dental radiation, if you went to a dental office and they took x-rays, that's not very much x-ray. And in addition, you have to understand that there can be, and certainly are, problems in the jaw and the teeth that cannot be seen unless there's an x-ray. So you have to weigh the risks and the rewards. You have to diagnose disease before it becomes more severe. And in the mouth, if you have infection, many people have infection that doesn't cause pain or swelling or bleeding, and they're not even aware of it, and the dentist doesn't even know about it. And that's the source of many chronic diseases. The infection or the dysbiosis in the gut could start the infection in the mouth, but once the mouth gets started, you need to treat the gut and the mouth concurrently. So the big issue is, are you exposed to a lot of radiation? Sometimes cancer patients get exposed to a lot of radiotherapy to kill cancer cells in certain conventional methods. There are certain means to neutralize the damage radiation creates in a collateral fashion with other healthy cells. For example, there is some very exciting research with molecular hydrogen, which is very natural that you can take, and it actually neutralizes a variety of very damaging free radicals that are created with radiation and other things too. But the radiation creates these very active hydroxyl free radicals that are very damaging to healthy cells. Well, molecular hydrogen neutralizes them to contain the damage from the radiotherapy that might leak into other parts of the body. So there are some methods that you could work with to take proactively before, certainly after having some kind of radiation therapy, especially in cancer radiation therapy.
Very interesting. So my audience, a lot of them are very interested in an animal-based diet or a carnivore diet. And I wanted to see if it's the ketosis state that it puts you in that can help with cases of cancer. Because I don't know if you're familiar with Dr. Thomas Seyfried. He's a cancer
Absolutely.
researcher.
Absolutely. Absolutely.
So maybe you can talk a little bit about that and how you reconcile that with the fruits and honey that you eat.
Definitely. As a matter of fact, I check my ketone levels all the time. I've done some interesting studies on myself. I'm like an N=1. So I've done interesting studies and I posted them in blogs, and you can see the graphs of my ketone levels after 72 hours of a water-only fast and other things. So yeah, absolutely. So ketosis is very important. It does a lot of things for the body to help repair itself. In the animal kingdom, if you go back and think about, broadly, the animal kingdom, ketosis is a normal thing. Our primal ancestors were probably in ketosis the majority of the time. They ate some fruits and some tubers and things, mainly animal-based foods, but they were probably in ketosis the majority of the time. But ketosis allows cells that are weak to kind of clean themselves out or to die off, so you can get more healthy stem cells to replace those bad cells or weakened cells. Ketosis is critical for that. Ketosis also stimulates your natural glutathione production and other natural antioxidants, talking about how you can detoxify from mercury. Well, this is the antioxidant system that works. You don't have to take any external antioxidants, just stimulate your own antioxidant system, and that helps to do that cleaning out process, and that's partially part of ketosis. Ketones are very clean burning fuels. The brain loves them. So about 70% or so of the brain's energy needs can be obtained from ketosis. If you're in ketosis and you're understanding, and I'll tell you about metabolic flexibility in a moment, but if you understand what ketosis feels like, it's really tremendous clarity of mind. If you ever had brain fog, it's really the opposite. It's completely clear because these ketones don't produce very many reactive oxygen species, which are free radicals, and they kind of gobble them up anyhow. So it really is a very healthy state, but your body is designed to not be just a fat burner, which is where the ketones eventually come from. You're burning fat. The fat cells are used to break down and are a source of energy, but the liver breaks down these fat cells and then makes ketones out of them. But ketosis is, from a fat burner, is just one source of a fuel your body is designed to burn. You have plenty of fat cells to last in ketosis for a long time, but glucose, carbohydrates, glucose, you need to burn also. So what I do personally is I stay in ketosis for, let's say, 5 to 6 days a week. How do I know I'm in ketosis? Well, my animal-based diet is primarily high fat, moderate protein, low carbohydrate. I eat approximately 2 grams of fat to 1 gram of protein, but I don't measure it. I just figure it out in my head, and very little carbs. Do I know I'm in ketosis? Well, I use a breath ketone monitor, and I can blow into this little monitor, and it will tell me what my ketone levels are. So if I'm not in ketosis, obviously there's almost no ketones in my blood. And if I am in ketosis, I am in dietary ketosis, and it can stay there for a long time. So I will eat that way, stay in ketosis, and then 1 or 2 days a week, and it's not critical how I do it, but I do it. Then I will eat a bunch of carbs, and I will eat 150 grams of carbs or whatever. And the carbs are not pizza and cheesecake. So the carbs are more fruit and more honey, that kind of thing. And I know I'm in not in ketosis, because when I use the breath meter, I can see my ketone levels are below ketosis level. So why do I do this? This is called metabolic flexibility. Your body needs to know and be exercised back and forth to burn carbs and to burn fats as I see it. And it's important to have that carbohydrate so that the insulin is being stimulated. Insulin is there for purposes too. And we need to have this natural pathway functioning in our body on a regular basis. Our primal ancestors did this without thinking about it. And I'm trying to do it by thinking about it. And so I am not in ketosis 100% of the time. Now, when I started a strict carnivore diet in January of 2020, it was strict, it was no carbs, and I stayed in ketosis for the majority of a year or so. Cancer patients, I think that there are benefits to that. Certainly the Paleolithic Paleomedicina Clinic professes that that's the way it should be. Now, Thomas Seyfried also suggests ketosis is ideal for a cancer patient, but you know, cancer cells don't only eat glucose, as Thomas Seyfried discusses and describes continuously. They also eat glutamine. So that there are other fuels that cancer cells eat. Glutamine is an important amino acid that's important for other pathways. I know that Dr. Seyfried is working in different ways in hospital settings to pulse in and out of glutamine, and that is a difficult thing to do, certainly as an individual. I don't do that. My goal is to not just look at the food that cancer cells want to eat. I'm looking at all the other things to support the immune system in addition. But I do believe ketosis is an important element, and I do stay in ketosis for the majority of the week. And I know that I'm in it because I use the meter.
Okay.
Oh, and your question was about raw honey. I know the raw honey that I eat, which is Manuka honey. The Manuka honey I get, I can eat a tablespoon. That's a lot of honey. And there's only 17 grams of carbs in the tablespoon of Manuka honey that I have.
Right.
So 17 grams of carbs, I know, does not throw me out of ketosis because I can use the breath meter and I'm still in ketosis.
I see.
For my body, it seems to be if I eat more than 30 grams of carbs a day, I'll maybe get out of ketosis, or I'll be in a very, very, very low level of ketosis. Other people are different, but for the most part, if I eat a tablespoon of honey, or maybe a teaspoon of honey and an apple, that doesn't throw me out of ketosis. So again, I know it because I'm testing my ketone levels.
Well, okay, so even when you are including those, you are still in ketosis. That's why you're spending
Correct.
so much time in ketosis.
Correct. Now, if I were to eat 3 tablespoons of honey, it would throw me out of ketosis. If I were to eat an apple, an orange, and a mango, it would probably throw me out of ketosis. But if I am eating very selectively and I see that my ketone levels are staying above or in the dietary ketosis state, then I am in ketosis. I'm very happy about that. Even though I've eaten some carbs, it's still very low carbs and it doesn't throw me out of ketosis.
Okay. Are you exercising?
So before all this nonsense started with the COVID and the weak muscles and all the other issues that came up, my exercise program was I walked a mile every day, which I loved, and I love to get out. Right now I have a lot of issues with my legs, so I can't walk, certainly outside. I was also doing modified squats. I was doing modified push-ups. So yes, I was doing body weight exercises in a modified way. Again, you have to realize my bones are very fragile. I can still easily break a bone and be, and be in serious trouble. So I am very careful about what I do. So walking outside is great, and I do modified squats, modified push-ups, and even some barbells or dumbbells that I was using just for biceps and things. But that was all done inside of the house, other than the walking was outside.
And now afterwards, after all of this stuff started to happen again, you can't be doing that, or are you doing this still?
So right now, the exercise program has come to a halt, which is terrible, but it's only because of the physical limitations. Actually, tomorrow I start hydrotherapy with physical therapy at my cancer hospital, so that I'm going to start re-exercising and rebuilding the muscles that have obviously degenerated, and then hopefully get back to my routines.
Awesome.
Yeah,
Awesome.
I'm looking forward to that.
And because we're talking so much about the immune system, assuming that you are supplementing with nutraceuticals to boost your immune system?
Oh, absolutely not. Why would I even do that? No.
Okay, so
this is a misnomer, and this is, I think, a huge problem in the supplement industry. My God, once COVID came about, everybody's and their uncles and aunts that are in the business want to sell you bottles of this, that, and the other. I don't believe in supplements for the most part. Sometimes, yes. And if there is necessary supplementation for a therapeutic issue for a week, 2 weeks, maybe even a month, to get something that is so out of whack into a normal realm, that's fine. I'm not a medical doctor. I'm not trying to treat these issues. But you will get every nutrient your body needs to support your immune system from a thoroughly designed animal-based diet, nose to tail. Now, that doesn't include chicken and pork, which is very high in linoleic acid. We want the things that are very nutrient dense, but don't have other issues that are irritating to the gut microbiome or damaging the mitochondria, which linoleic acid will do. So no, there are no supplements, except because I can't get out in the sun, I need to maintain a high vitamin D, 25 hydroxy vitamin D level. And I want to make that level between 60 and 80 nanograms per milliliter. So I want to get that, and I do that by taking, right now I'm taking 10,000 international units of vitamin D3. And along with that, which is very important, you need vitamin K2, because you have to direct. Vitamin D3 has a lot to do with calcium metabolism. If you're not getting vitamin K2, the calcium could be deposited in soft tissue rather than bone structure. That's not good. So vitamin K2 helps direct the calcium to go into bone structure or hard structure, not in soft tissue. And I literally take 300 micrograms of vitamin K2 along with the 10,000 international units of vitamin D3.
Okay.
That's what I take as a supplement.
What about omega-3s?
If you are eating grass-finished, grass-fed ruminant animals like beef and lamb, you're getting adequate vitamin D3, vitamin omega-3s to omega-6 ratios. So that's not critical. But I do eat seafood, but it's not the critical animal food that I eat. So I'll eat some seafood once a week. Maybe, you know, salmon is great, sardines are great, all wild caught. I use certainly shrimp, local in Charleston, South Carolina. Shrimp is caught off the shores of South Carolina. So I get local shrimp. You know, these are things that I do eat, but primarily, if we're looking at a 7-day-a-week thing, I'll eat ruminant meat, red meat, 5 of those days.
And you said that you eat nose to tail, so you're eating organs, right?
Yes, yes. So let me tell you how I eat organs. I have no problem eating liver. I love liver, not a problem. Sweetbreads, which are thymus gland, when I can get it, phenomenally delicious. But do I eat organs in any other fashion? Yes. You will call them probably a supplement. I never call them a supplement. I eat organs that have been literally freeze-dried. There has been nothing added and nothing removed other than water. It only is contained in a bovine collagen capsule, so it's not a vegetable capsule. This is all animal-based. So there are all the nutrients that are in the liver, in the thymus, in the spleen, pancreas, all the organs is there in a powder form. It is a food that is a powder. So I don't call it a supplement, because when I hear a supplement, it means to me it is processed and something is removed and it's not complete. So the ratios of all the elements are not complete. And then there are other elements, chemicals that are put into it as a preservative or a hardening agent to make a tablet out of it. That's not what I take. I take a variety of organs that are desiccated, that are from grass-fed, grass-finished New Zealand cattle.
Yeah.
There are several companies that do a wonderful job of that.
Yeah, me too. I agree. I think that is the best form of multivitamin, if you
Oh, without a doubt. And multivitamin, multimineral. Absolutely. Absolutely. So I don't do those other over-the-counter, no matter what company they're selling these nutraceuticals. I'm not interested in them at all.
What about Dr. Linus Pauling's work on vitamin C? I know he was obsessed with vitamin C.
Well, he had problems too with vitamin C, didn't he? So vitamin C, if you take too much vitamin C, it turns to oxalates. That's not a good thing in the body. And vitamin C is an indiscriminate neutralizer of free radicals. So what it will do is neutralize all the free radicals that it can get to, including all the important free radicals that are part of the metabolism. That's why molecular hydrogen, if you want to say, take something that is a really good antioxidant, but not a indiscriminate neutralizer, that's molecular hydrogen's role. It doesn't damage or neutralize free radicals that are part of the metabolic pathways. It only scavenges and neutralizes the excessive reactive oxygen species or free radicals, especially the hydroxyl radical, which is extremely unhealthy. There is a paper that was published by Paleomedicina Clinic about vitamin C, showing you're going to get all the bioavailable vitamin C you need if you're eating animal organs.
Yeah, that's true. And another thing is molecular mimicry with glucose. If you're eating a lot of carbs, you're blocking vitamin C absorption. So it makes no sense really to have an orange, for example.
Absolutely. And that's an important part of this paper that I just mentioned from Paleomedicina Clinic, that vitamin C competes with glucose. So if you're eating a lot of glucose and carbs, you have to really push vitamin C just to get it into the cell. The same thing is true with magnesium. So magnesium, Paul Saladino did a very excellent audio or video recently, and Paleomedicina Clinic also has an article about magnesium, that of all their patients, they've treated thousands of patients, over 5,000-6,000 patients in the last 10, 12 years. None of them have vitamin deficiencies of magnesium, yet they're on a strict animal-based diet with no supplements and no pharmaceutical drugs. Two very interesting papers that they've published in the last several years about that.
Interesting. I was not aware of that. That's awesome. Have you heard about stem cells? Those are recent developments in regenerative medicine. And I was watching an interview with Tony Robbins, who just wrote a book about all of the latest regenerative medicine and anti-aging tools. And he was, in all the interviews he's doing, promoting it, he's talking about how there's a case of injecting stem cells, literally curing leukemia, an incurable disease. And I'm curious as to if you know anything about that.
Well, don't forget, if you can get the right stem cells that are precursor to the cells that are damaged in your body, obviously that makes sense. Now, the theory and the reality are two different things. Wouldn't it be nice to stimulate your own stem cells to do what it's supposed to do? There are, again, some interesting research studies about molecular hydrogen, how it actually stimulates stem cells in the body. Molecular hydrogen has been researched for over 15 years. I wrote a paper on molecular hydrogen, and I cited about 27 medical papers of all kinds of different things that it has been shown to provide, which is quite fascinating. So stem cell therapy in and of itself makes a whole lot of sense, but in humans, if I were to be thinking of stem cell therapy, which I'm not a good candidate for, but the entire immune system, your stem cells are extracted and grown, or selectively frozen, or whatever they do, and then your entire immune system is destroyed. And then those cells are reimplanted in your bone marrow, as I understand it. I'm not sure all the process, but there's so much that is now needing to be recreated artificially in your immune system. It doesn't always work, right? Stem cell therapy doesn't always work. Theoretically, it makes a whole lot of sense. So also ketosis helps with longevity, and it helps to reactivate stem cells. High intensity interval training helps with longevity and stem cell regeneration. Circadian rhythm, getting enough healthy restorative sleep helps with stem cells. So the body can do some very exciting things.
True. Yeah.
As to, is stem cell therapy going to treat cancer? Yeah, I think it does treat cancers in certain ways. There are complications. Just like the immunotherapy that I have undertaken that now isn't working for me. Theoretically, it would be the ideal thing for every multiple myeloma patient to take this immunotherapy, this monoclonal antibody, to kill plasma cells, but it has side effects. These are side effects that eventually can create issues, and maybe in the beginning create issues for some people, and maybe later on, like me, created issues. So you have to realize that there is no hard answer here. And pharmaceutical industry is well known for bringing drugs to the market and doing many, many years of research before they brought them to the market. And then they've been withdrawn in a couple of years because too many people die from the drug. So, you know, there are complications that these synthetic molecules just don't do what our bodies biologically know how to do.
Right, right. Okay. And anyway, also you said that you are not a candidate for that. Like, even if it was, let's say, proven safe, or we had more data, you are not a candidate for that, correct?
Well, my oncologist and I went through some of the details, and most likely it was because I did not want to destroy my immune system to gather stem cells, destroy my immune system, and then by chance rebuild it. I know what medicine can do, and I know what medicine would like to do. And what they'd like to do, they don't do always as well as I'd like them. Just like just like I'm not taking synthetic supplements. You know, certain supplements have been proven to be very beneficial. Well, maybe they are, maybe they're done in vitro, maybe they are, but with all the other additives in these supplements, and they're extracted and chemically processed, the body doesn't recognize it as the bioavailable nutrient that our body requires. I may be talking out of line, but I do believe the body knows how to heal itself as best as it can. It does need external support therapeutically at times. I totally get it. When I was a periodontist practicing with for 44 years, and I had patients that had severe infections, I would put them on a systemic antibiotic, not because I wanted to kill their gut microbiome. I knew that I'd have this collateral damage, but we needed to get the other highly aggressive acute infection under control. But then I supported the damage that those antibiotics would have produced right from the beginning to really help to recreate a healthy gut microbiome. Sometimes you have to do that. But in general, certainly antimicrobial mouthwashes on a daily basis are a no-no. Using toothpaste that have chemicals that kill bacteria is a no-no. Using toothpaste that bind to minerals like charcoal and bentonite clay, to me, is a no-no. There is no necessary reason to do that on a daily basis.
What toothpaste would you recommend?
For first of all, you don't need a toothpaste to brush your teeth. But if you were to use a toothpaste, and there are many out there, I guess, but one of the toothpastes that I've actually worked with is called Revitin, Revitin. It's on Amazon, it's on revitin.com. This is an all natural based toothpaste that does not damage the oral microbiome, doesn't kill indiscriminate bacteria. So it allows the natural bacteria to grow in its biologically balanced state. We have maybe 700 or so species that we know of bacteria in the mouth, maybe 200 to 300 different species that we know of in dental plaque. There may be many, many more that we don't know yet about that are difficult to culture. So these bacteria, some of which are extremely pathogenic if they overgrow, but they're there for a purpose. You don't want to kill dental plaque. Dental plaque is healthy until it's not. You don't want to scrub it off and denude the surface where the gum meets the tooth. It's a natural, healthy biofilm that kills other pathogenic bacteria. And it also helps put minerals into the root surface to remineralize the tooth as necessary. And it maintains a pH of 5.5 or higher so that the tooth doesn't decay. This is natural, healthy biofilm. Now, it gets unhealthy when the gut microbiome is unhealthy. It makes the oral microbiome unhealthy. If you're eating unhealthy foods that feed potentially pathogenic bacteria that can overgrow, creating gum disease and tooth decay, that's a different story. But dental plaque is healthy until it's not. And you don't want to use mouthwashes to kill it. You don't want to use xylitol to stop the production of the film of the biofilm, the film of the plaque that's attached to the tooth. You don't want to use mineral binders that can bind to natural minerals that are in the saliva that are necessary. You don't want to do that. That's not the way the body works.
So that means that if you convert to an animal-based diet or a carnivore diet, that obviously is going to improve any kind of periodontal disease or maybe even completely.
Absolutely, prevent it. Absolutely. There is a skeletal remain from 300,000 years ago. It's the oldest Homo sapien skeleton that's been discovered in Morocco, I think 3 or so years ago. If you look at that skeletal remain of the jaw, the humans have 16 lower teeth, 16 upper teeth. The lower jaw has 16 lower teeth. If you look at that skeletal remain, there is no damage in the bone of the jaw. There is no visual decay on any of those teeth. The surface of the teeth have severe wear, meaning that they've done a lot of chewing. So that individual was probably at least in their late 20s, early 30s before they died. And in between the teeth, if you look at the remains, there's a bunch of junk. That bunch of junk is calcified plaque called tartar. So that individual, like every human, has dental plaque that has calcified, no sign of tooth decay, no sign of periodontal disease or bone destruction. And why is that? Well, the food was healthy. They never went to a dental cave to have fluoride put on their teeth. Well, obviously, we're not missing fluoride in our diet. So their diets were healthy. There were no chemicals that they were ingesting. Mm-hmm. And their gut microbiome was a happy set of guys that were all commensal and working together without creating immune problems and all kinds of damage to the oral environment. So yeah, if you're eating very healthy, your mouth should be healthy. And I have many clients that have told me, and they're shocked, I used to have bleeding in this upper left molar and it stopped. Why did it stop? Well, you're eating healthy now and you've changed your gut microbiome because we've done a bunch of coaching and you're doing different things and your infection is going away and the bacteria is balancing more naturally.
Amazing. Yeah, that's great.
And most practitioners don't know about the oral cavity. So the problem is a lot of people know how to treat the gut, but if the infection already is in the mouth and it's already deep, just treating the gut won't stop the infection that's already deeply set in the mouth. So the mouth infection must be treated correctly, and the gut infection, dysbiosis, has to be treated correctly. And then you will have a cure.
Right.
That's critical. Both have to be treated.
Right, right. Yeah, you can't just put a Band-Aid on the symptoms for a short period of time.
Exactly.
And the underlying cause getting worse and worse.
Exactly.
Dr. Al, what gives you hope?
Gives me hope? Oh my God. Well, my wife gives me hope. She is a pillar. You got to understand, I am as human as everybody else. I get very depressed, especially recently when things were not working well with me. My wife pulls me up out of bootstraps. She verbally slaps me in the face and says, get your head together. And sometimes I do, a lot of times I don't, but eventually I do. So she gives me tremendous hope. The other thing is, I think I'm here on this earth for a reason. I have some interesting spiritual beliefs. I'm not religious. So of all the religions, I don't say I am this or that. I was raised in a religion, but I don't practice it as such, but I am extremely spiritual. I think our soul lives on. I would think we're in a body that is, has an endpoint, but I think our soul lives on. And I even believe that we're here more than one time. And I believe we have lessons to learn. And I think one of the lessons that my soul is learning is to deal with this traumatic life change that I've had. And maybe my purpose is to share my knowledge, which I try to do. And I do quite a bit internationally, which, it's kind of fun for me. And so that gives me a lot of hope, because I'm telling a lot of people now, there are a lot of people that really think I'm crazy. Especially vegans, have literally yelled at me on the internet with their capitalized words and in bold, telling me I'm killing people with red meat and I need to get off their website. I mean, they have said things that are just vicious, but it is what it is. When I look at our species, I think I'm doing what our species has evolved to do. I'm just trying to promote that for other people. Mm-hmm. And I think that our bodies can do wonders, but we're all going to die. And not everybody can repair themselves to the point where they're almost 100%. And I know that I can't, but I can improve my body as best as I can. The best thing and the most important thing is attitude. I don't have a great attitude all the time, but when I have a great attitude, I do. And I think that's very important for anything in life, your attitude. And I think that that's very healing also.
It's so funny how compassionate vegans tend to be the loudest critics and the loudest aggressors, in all domains, whether online or anywhere else. So
they are.
Isn't that ironic? So do you feel that we missed any important message that you would like to share?
No, I think this is very good. I think you've really delved into it very well. I do have a website that has all kinds of information that anybody can pick and choose. I have nothing to sell, by the way. I don't sell anything. The only thing that I sell, if you call it selling, is I do one-on-one coaching. But other than that, everything that's on my website is downloadable. You can do that. All of my information, I have cited references from medical journals all over the world that support my concept. So there is documentation of what I do, like my now 11 cancer protocols. They are detailed. Everything I take is cited. You can literally click on it and find out where I get what I get. There's no secrets. I know a lot of people that are out there give you an idea. Oh, this is my protocol. That's my protocol. And if you want it, send me X number of dollars and I'll send it to you. That I don't do that. It's right up front, everything I do, the way I do it. And when I make changes, and I do tweak it quite consistently, when I make changes, I just change what I'm doing. So it's always relatively up to date. It always has the date that I've recently tweeted it. So
okay, and I'm gonna make sure that I link your website there, also your Instagram. Where would you say you're most active, or where is it that you would can people go to see you? Obviously the website, but is there
Well, yeah,
any
Instagram. I do have a social media expert that really does a lot for me on Instagram, and she's really quite astute on how to do that. I'm not as digitally, or I know how to use a computer because I know how to use the program, but if anything, there's a glitch, I'm totally lost. So I do everything on my website. I do write my blogs personally. Nobody writes them for me, and certainly I don't have any guest blogs. Everything is my original work, and all my original research is right there.
Wonderful. So I'm going to make sure I link everything so that people can benefit and look up your work and find you. Thank you so much, Dr. Al. I am so excited still, and I'm so happy that we got to have this conversation. And for everybody watching, I hope this was helpful. If you like this content, make sure you give it a thumbs up, subscribe, and hit that notification bell icon so YouTube alerts you every time I post a new video. Thank you all for watching, and I will see you in the next one.